Good afternoon, everyone. Thank you for joining us for today's webinar. Just before we begin, we'll pause for a few moments while we let everyone connect, and then we'll go over some housekeeping regarding the GoToWebinar platform. Good afternoon, everyone. Thank you for joining us. During this webinar, you'll be able to add questions for our panelists via the drop-down in your control panel marked questions. You can post questions at any time, and please feel free to do so. We'll be having a discussion and question and answer session towards the end of the webinar. Your mics and cameras will remain off for the duration of the session. This webinar is being recorded, and the recording will be made available on the ACMS website and ACMS YouTube channel. ACMS hosts webinars to share information and discussions across a range of topics. We welcome the opportunity to highlight the research of others and centre the voices of those with lived experience. Through these, we seek to grow capability and knowledge across the sector. I'd now like to introduce Kieran Sampson from the translation team at ACMS. Welcome, Kieran.
Hello, thank you for joining us. I'd like to begin this webinar, this event, by acknowledging that we live and work on lands whose sovereignty was never ceded, and acknowledge the deep connection that Aboriginal and Torres Strait Islander peoples have to country and community throughout Australia. ACMS supports the Aboriginal and Torres Strait Islander voice to Parliament being enshrined in the Australian Constitution. We seek to see our children thrive. We believe children are central to the Uluru Statement, and through the voice to Parliament, change can be driven to build a better future. We pay respect to Elders past, present and those yet to be. Thank you for joining us for today's webinar, the Australian Child Maltreatment Study, Pathways to Positive Change. This webinar does include discussion of child maltreatment that may be confronting and distressing for some of you. So if you do find that you need to talk to someone, support is available, and will be the contact details of places that you can reach out to are on the screen at the moment, and we will pop them into the chat as well for referral later. In April this year, the Australian Child Maltreatment Study team, which you may hear abbreviated to ACMS, published the primary outcomes of their study in a special supplement of the Medical Journal of Australia. The research shows a large percentage of Australians have experienced some form of child maltreatment. This study sought to identify the extent of child abuse and maltreatment in Australia, while also identifying long-term implications on both physical and mental health. Today, we're very lucky to hear from Professor Daryl Higgins, Director of the ACU Institute of Child Protection Studies and part of the ACMS research team. He'll outline the findings of the research and the implications that they have for health outcomes. And following Daryl, we're lucky enough to also have Rani Kumar, the Deputy CEO of NAPCAN, who'll highlight some of the practical actions that we could pursue to increase the prevention of child maltreatment. Professor Daryl Higgins is Director of the Institute of Child Protection Studies. His research focuses on public health, approaches to protecting children and child-safe organisational strategies. He's a registered psychologist, and for 30 years, he's been researching child abuse prevalence and impacts, public health approaches to prevention, child protection and out-of-home care systems, family law, family violence, family wellbeing and past adoption practices. So I think he might know a thing or two. He's published numerous articles, papers and reports that have made a significant impact on policy related to child maltreatment, both in Australia and internationally, and most recently was one of the chief investigators in the Australian Child Maltreatment Study team. Welcome, and thank you for joining us today. Please welcome Professor Daryl Higgins.
Thank you, Kieran. It's great to be with you. And I'm hoping my slides are going through. Yes, perfect. I'd like to, on behalf of the ACMS team, acknowledge country that we're coming from. So today I'm coming from Wurundjeri lands of the Kulin Nation down here in Melbourne. And on behalf of all of the ACMS team, we pay our respects to elders past, present and emerging. And acknowledge the significant funding that we've had for this study from the National Health and Medical Research Council, as well as a range of other government departments and agencies. And speaking of the team, it's a large team led by Professor Ben Matthews at QUT, and here's the mug shots of all of us. As you mentioned, the study is published, and it's actually all open access, which means it's free to download and read the original articles for yourself. So please do that, and also have a look at some of the infographics and other links to articles in publications like The Conversation that provide a more chatty style of discussion of the results. And all of that can be accessed here on the ACMS website. So why did we need a study like the ACMS, and what has it done? Up until our study, we did not have nationally representative data on the population's experiences of child abuse and neglect. We'd relied, whenever anyone said, what's the problem of child abuse and neglect, we'd relied on data that comes from our state and territory child protection departments of harm or risk of harm that's notified to them. But that's not the same thing as understanding at a population level people's own experiences of child abuse or neglect. So for the first time, we had 8,500 nationally representative participants aged 16 and over answer a computer-assisted telephone interview. We used random digit dial, which means every Australian had an equal chance of participating. We had 3,500 of our participants in our young adult sample, so aged 16 to 24. The purpose of that is to allow better comparison with any future studies that might use a similar methodology and measure prevalence in 16 to 24-year-olds in 5 or 10 years' time. But also it's the group that has experiences of childhood that are not so distant in the past. But we did still want to measure those early childhood experiences of older Australians in order to understand the health and health risk behaviour that might be associated with child maltreatment. And so we had 5,000 adults aged 25 and over, with 1,000 in each of the 10-year decades, 25 to 34, etc. We measured all 5 forms of maltreatment, and no other prevalence study in Australia has been nationally representative and covered all 5 forms of maltreatment. We looked at a range of other familial risk factors and other adversities, including peer bullying and sibling violence. And you can see on the right-hand side the list of outcomes that we measured, and I'll go through some of those in some more detail. In terms of maltreatment, we asked how old were they when it began, if they'd said yes to any of our screener questions. And remembering that this is not a study asking about were you a victim of a particular type of abuse or neglect, we just asked, before you turned 18, did this ever happen to you? And then we had a range of behaviourally specific questions that focused on the 5 different forms of abuse or neglect. So as you can see here, we asked about how old they were when it began. For physical abuse, sexual abuse and emotional abuse, we also asked who was it that did those acts. In relation to just physical abuse and sexual abuse, whether they had ever told somebody about it, how old they were, who it was that they told, and whether they received support. And then finally, for physical abuse, sexual abuse and exposure to domestic violence, we also asked a frequency count, how often it happened. But for emotional abuse and neglect, which are about a pattern of behaviour, instead of asking frequency, we asked over what time period did it occur? Was it weeks, days, months or years? So the results, what did we find? Shockingly, we found that 62% of Australians have experienced one or more forms of child maltreatment. The rate was even higher for women. 65.5% of women said that they had experienced one or more of the maltreatment types that we looked at, compared to 58.4% of men. When we look at each type individually, these are the prevalence rates that we have. Physical abuse was reported by 32% of the population, sexual abuse by 28.5%, emotional abuse 30.9%, neglect 8.9%, and the largest percentage of all was exposure to domestic violence. Almost 4 in 10 Australians, 39.6%, reported exposure to domestic violence during their childhood or adolescence. But if you add all those figures together, we know that that comes to more than 100%. And so I'm going to talk in a moment around what we call multi-type maltreatment. But before I do that, let's just have a little bit more of a breakdown by gender. We said that women overall were more likely to have experienced child abuse and neglect. But if we drill down to which particular types, you can see here the stark reality that women are much more likely to have experienced during childhood or adolescence 2 particular forms of child maltreatment: sexual abuse and emotional abuse. So sexual abuse around double the likelihood, 18.8% of men reporting it and almost 38% of women. And similarly, stark differences, statistically significant for emotional abuse. This is just some data for our youth sample. This is the 3,500 participants aged 16 to 24. We can see some reductions in different forms of child abuse and neglect, particularly physical abuse, which is down from 32% to 28%, sexual abuse, which was 28.5%, down to 25.7%. But unfortunately, that's offset by rises in emotional abuse, neglect, and exposure to domestic violence compared to the sample as a whole. And you remember I talked about those gender differences. We can see they're even more stark in the youth sample, with 2.5 times as many women as men reporting sexual abuse during childhood, and similarly strong differences for gender in relation to emotional abuse. These maltreatment events are not trivial, they're usually not one-off. Here's the data on the frequency or chronicity of those events. So physical abuse, the typical, so the median number of events was 9.5. Sexual abuse, again, the typical experience is 3.5 different events of sexual abuse across childhood and adolescence, either from the same or from different perpetrators. And exposure to domestic violence, a massive 11.8% was the average, the typical experience. Emotional abuse and neglect, remember we did not have a frequency count, but over what time period, and the median was not weeks or months, but years. I mentioned before the concept of multi-type maltreatment, because if you add all those numbers together, it comes to way more than 62%, and in fact, way more than 100. Why is that? Because the typical experience of Australians is to have multiple types of maltreatment, what we call multi-type maltreatment. So this is just the youth data, age 16 to 24. Over 2 in 5 Australians have experienced multiple forms of maltreatment, which is bigger than the group that experienced no maltreatment at 38.8%, and substantially bigger than the group that experienced one type and no other at 21%. And looking at the more severe end of this spectrum, around 1 in 4 experienced not 1, not 2, but in fact 3, 4, or 5 different forms of maltreatment. You can see in this illustration the pattern of those overlaps. So on the outer edge, you can see, for example, emotional abuse was experienced on its own by 2.6% of the population. Sexual abuse on its own by 6.7% of the population. Physical abuse by 4.8%, and exposure to domestic violence 8.4%. But even exposure to domestic violence was present in the 5 most common overlaps of multi-type maltreatment. And going right into the middle, you can see the group who have experienced all 5 forms of abuse and neglect, and that was 3.5% of the population. So this tells the picture that maltreatment is neither an isolated event in terms of its chronicity, nor is it isolated in terms of the likelihood of experiencing exposure to different forms of child abuse and neglect. Those overlapping forms are what we found across all of our data to be associated most strongly with mental health, poor mental health and health risk behaviours. And so we wanted to understand why it was that some children grow up in circumstances where they are exposed to multiple different types of abuse and neglect. So we had measured 4 different familial related risk factors that we might call adverse childhood experiences. Each of these 4 family related factors were associated with more than double the risk of experiencing multi-type maltreatment. And you can see them on the screen here: parental separation or divorce, living with someone who was mentally ill, suicidal or severely depressed, living with someone who had a problem with alcohol or drugs, or growing up in the context of family economic hardship. So risk factors that substantially increase the likelihood of experiencing this most common and strongly associated with negative health outcomes across life, this presentation of multi-type maltreatment. I mentioned before that there was some good news in reductions, and here's an example of one where the rate of physical abuse in the 16 to 24-year-olds of 28% is significantly lower than for most of the other age groups that we had in our sample, which shows that change is possible. Here's another one: familial sexual abuse has declined, with the 16 to 24-year-olds 4.4% compared to around 7 to 9% for most of the other age cohorts. Unfortunately, that positive news is offset by some increases in other forms of harm. And you can see on the right-hand side one area that is responsible for that, and I'll talk about that in a moment. This is just the data for all of the sample. So we found that one of the biggest groups of people who they experienced sexual harm from was other known adolescents aged under 18. So 12.9% of the population experienced sexual abuse by another known adolescent, 1.4% by an unknown adolescent. Whereas adults at the other groups there, you can see institutional caregivers were 2%, unknown adults 4.9%, a parent or other adult caregiver in the home was 7.8% of the population, and other known adults was 7.5%. But I mentioned the idea of some positives of child sexual abuse reductions in familial child sexual abuse being offset elsewhere, and here's one example. So sexual abuse by other known adolescents has substantially increased. So abuse by an adolescent who the victim knew but was not a current or former romantic partner was overall 11.2% for our study, but 13.7% in the youth sample. And breaking that down by gender, we can see double the rate for women compared to men. And then for sexual abuse by an adolescent aged under 18 who was in a current romantic partner or a former romantic partner relationship, overall 2.5% of the sample said that they'd experienced this, but substantially higher in our youth sample at 5.7%, and massive gender differences, with almost 1 in 10 young women reporting that they'd experienced sexual harm from a current or former romantic partner. Looking at the health consequences here in terms of mental health disorders, we found that almost half of people who'd experienced child maltreatment have a mental disorder, compared with only around 1 in 5 people who did not experience a mental disorder. Put another way, we can see here that 78.4% of those with a mental disorder have also experienced child maltreatment. So massive disparities there in the contribution that child maltreatment makes to risk or likelihood of a mental health disorder in adulthood. Breaking it down by the 4 different types that we were able to measure in our study, you see depression on the left there, 24.6% of those who'd experienced child maltreatment reporting lifetime major depression, compared to only 8.1% of those who had not experienced child maltreatment, and similar patterns across generalized anxiety disorder, current, severe alcohol use disorder, current, or PTSD, current. We then looked at what are called odds ratios, and that's the increased likelihood of an outcome following a particular exposure compared to the odds of that outcome occurring in the absence of that exposure. So anything greater than 1 means that the events are more likely to occur. And so you can see here for all of the mental health disorders, the odds, the likelihood of experiencing any mental disorder was substantially greater than 1. So overall, 2.8 times the likelihood of any mental disorder, with again strong gender differences, with women much more likely than men. And then looking at each of the 4 types that we assessed, you can see here substantial and significant increased likelihood of each of those 4 mental disorders if the person had experienced child maltreatment. I said before that overall, multi-type maltreatment was the factor that was most strongly linked with both mental health and what I'm going to say in a moment in terms of health risk behaviours. But when we looked individually at each of the different types of child maltreatment and took into account any other child maltreatment experience that they have also had, the 2 that stood out as uniquely contributing to to each of the mental health disorders that we measured was sexual abuse and exposure and emotional abuse. So each of those 2 things were approximately doubling the risk of PTSD, anxiety, severe alcohol use disorder, and depression. So turning now to health risk behaviours, we see a very similar pattern with very substantial odds ratios, well, substantial across all of them, but really significant ones for cannabis dependence, self-harm in the prior year, or suicide attempts in the prior year. So for example, cannabis dependence, 6 times the likelihood of having cannabis dependence if you'd experienced maltreatment compared to no maltreatment. And very similar patterns again, once accounting for any other maltreatment experiences that they had also had, sexual abuse and emotional abuse were the 2 standouts, more than doubling the likelihood of many of the different types of health risk behaviours, particularly self-harm, suicide attempts, and cannabis dependence. Looking again at the gender differences, you can see here substantial differences, and the real standout, of course, is cannabis dependence, where 20 times the risk for women compared to 4.5 times the risk for men if they had experienced child maltreatment. And equally strong relationships with what we called health service utilisation. So things like 1.4 times more likely to be admitted to hospital if you had experienced child maltreatment, 2.4 times more likely to be admitted for a mental disorder or to have 6 or more visits to a GP, and 2.3 times more likely to have 24 or more visits to any health-related practitioner. So we can see here the really massive systems cost that can be attributed to child maltreatment and therefore its economic burden. And we know that child maltreatment is likely to be a common contributing factor in people presenting to health services for a range of different reasons. It can activate the kind of biological stress response. It can trigger epigenetic changes. It can heighten threat perceptions. It can alter emotional regulation processes, shape beliefs about self and others, and certainly, as we've seen from our data on things like cannabis misuse, increase the risk of harmful ways of coping and relating, and of course those effects can cascade over time. So to wrap up with, we've seen that child maltreatment is endemic, that multi-type, that exposure to more than one different form of abuse or neglect, is in fact the common or most typical experience. That Australian youth are suffering now. So the youth sample, while it had some small reductions, for example, in physical abuse and some forms of sexual abuse, that the rates of child maltreatment are still high, and some of them are higher than in earlier generations. That girls are at much greater risk. And finally, that health impacts accrue quickly. So what do we need to do? We need to have national coordination on our approach. We need to invest more, but better. And we argue that the key to that is what we call a public health approach, emphasising prevention. And I know that this is something that Rani will pick up in her discussion. We need societal level change. We need to have broad policy for social determinants. Things like the economic hardship that our data shows more than doubles the risk of experiencing multiple forms of child maltreatment, which in turn increase the risk of mental health and health risk behaviours. And we need to have community changes, so across different sectors, to support and respond to maltreatment across health, education, and a range of other allied health services. But at the individual level, we need to think about what are the supports that parents need in order to parent safely in emotion-focused, non-violent, non-coercive ways. And central to that is what we're calling an emotional revolution, a real paradigm shift to address the massive harm that's associated with emotional abuse, which is not only highly prevalent at more than 30% of the population experiencing it, but was one of the two types of maltreatment that was uniquely associated with those negative outcomes, alongside sexual abuse. And of course, we're arguing for a real turbocharged approach to prevention and child sexual abuse prevention education for children and young people. And we're calling that a sexual and relational evolution. So what do we need to do? I think that across a whole range of different sectors, we need to recognise the lived experience of our clients, so children and young people, parents, particularly for children in systems where we might be seeing them partway through their childhood to understand the risk of further abuse and neglect that might be going on, even if we've identified harm from a previous experience of abuse or neglect. But also the childhood lived experiences of staff who are working in our services and systems. We need to make sure that across a range of different services, including schools and early childhood and health services, that we're actually trauma informed and of course culturally aware, that we're child focused, but paying attention to some of those key points that I made around when parents are more likely to be at risk of children in their care being exposed to abuse or neglect, either at their own hands or at the hands of another adult or in fact another child or young person. So that's when they're separating or divorcing, when they're struggling with their own experiences as a parent of mental ill health or substance misuse, when they're trying to parent and raise their children in the context of economic hardship and where they themselves are experiencing family violence. And so we need to tailor our supports to those different adversities and work across silos to address the high likelihood of children's exposure to multiple types of harm. And so to wrap up, that really says we need to be thinking about what a prevention workforce can look like right across different sectors and different services that enables parents and those caring for children to really bring about attitude change, to be valuing children and upholding their rights and prioritising safety, to know about and to deploy evidence-based supports to improve parenting skills, to create safe environments. And finally, to think of some of the successes that we've had in implementing child-safe organisational strategies in youth-serving organisations, and to think about what that might mean in the home. So to teach parents and caregivers to be able to think in a similar way to how we've been thinking in those youth-serving organisations about risk and about building the capability of parents and carers and those in contact with children to support knowledge about sexuality and skills regarding consent and respect, and most importantly, listening to and responding to their safety concerns, including harmful sexual behaviour from other children and adolescents. So that finishes the ACMS part of the presentation, but I just want to finish off before I hand back to Kieran and to Rani to keep talking about this. I just want to make a couple of points around what we call the public health approach. I've referenced that, talking about primary prevention, but what this says is that so often in problems like child maltreatment, that we often focus on that top end of the triangle, the tertiary responses, intervening after children have experienced harm. We have some investment in secondary supports for families where there are identified risk factors, and the focus being about stopping problems from escalating. But we have much less focus and almost no visibility on what's happening at the primary level. So in those universal services like schools and early childhood education, health services, about supports and programs for parents and carers in order to prevent maltreatment from occurring in the first place. My colleagues and I have done some analysis of what are appropriate public health approaches, and the 6 kind of core components that should underpin it, you can see on the slide here. It means that we need to focus on known risk factors for child abuse and neglect. We have to intervene using whole of population strategies, so not ones that are just targeted at narrow subgroups. We have to intervene earlier, focusing on early interventions and primary prevention, drawing on the evidence about what works, so using efficacious evidence-based approaches, basing our services in what are called non-stigmatizing and accessible community-based platform, and finally bringing about change at a scale using kind of sustained and sustainable strategies to address those structural determinants and to focus on community mobilisation. Here's just some examples of how we can break up that continuum from universal through targeted or secondary or selective interventions through to what we might call indicated or tertiary prevention. The kind of key features of those, and just some examples at the bottom of some programs that have been shown in the evidence to work at those particular levels, those ways of intervening. I think I'll hand back now because I know that Rani's going to talk to this slide, but thanks Kieran for that opportunity to share.
Thank you, Daryl. There's some really interesting things that have come out of that study that I think you know, everyone would find surprising. So very worthwhile work. Yes, next I'd like to introduce our second panellist for the webinar, Rani Kumar. Rani is the Deputy CEO of the National Association for the Prevention of Child Abuse and Neglect, otherwise known as NAPCAN. Rani has extensive experience in the children's welfare field, both in Australia and overseas. She's a skilled policy analyst and advocate for children's rights. And she's going to talk today about ways that we can make some difference along the lines of what Daryl has just alluded to. So welcome, Rani.
Thanks, Kieran. Thanks so much. And thanks, Daryl, for all your great thoughts. I mean, it's always hard to listen to the ACMS findings again, but there's some real, opportunities for change in there as well. So really looking forward to building on what you were saying. But I just want to acknowledge that I'm on the beautiful lands of the Gadigal people today here in Sydney, and pay my respects to elders past and present, and extend that to Aboriginal and Torres Strait Islander colleagues that are online today. So I guess I was tasked with talking a little bit about how do you prevent child abuse and neglect? What is prevention? What are some tangible ways we can talk about this? And obviously it's a huge question, but ultimately boils down to supporting the adults around children to enable them to better care for the kids in their lives, and enabling children and young people to really be heard and valued. So it's a lot of what Daryl was just saying, but in a more practical, what does it look like way. And there's a lot in both of those ideas? How do you enable the adults to, really be able to do better with their kids, and how do you really actively listen to children and value their perspective? And it's something that requires a lot of work at all levels of government and all levels of community. It's across portfolios, it's across levels of government. We have to think very differently. Like Daryl was saying, we need to kind of have a bit of a revolution around some of the conversations we've been having and think about systems very differently to how we have been. We all have a role to play, even if we don't have kids. And I think this is an important part of the conversation, that this isn't just a child protection issue. This is an issue that goes to the heart of everything we do as a country, as a nation. Every portfolio in government has an impact on the life of a child, even if its only direct impact is on the adult caregiver. So you can't just say, well, transport doesn't really impact children, they're secondary or tertiary to this, we're going to focus on the adult users. Actually, no, workplace laws, all of those things impact on the life of the parent, which then cascades down and has impacts in family life. So we need to kind of have these conversations in a more holistic way. And we know that children do better when their parents are supported. That is a fact. So as Daryl said earlier, parental separation, family mental illness, family substance abuse problems and economic hardship double the risk of multi-type maltreatment. We need to do better at supporting parents and families. So what can that look like? It's about taking quality services and making sure that they're really accessible for families according to their needs, so that they're not just a one-size-fits-all, but they're fit for purpose for where they are situated. It's also something that we need to really ask governments to invest in. I mean, communities can do better, and there's things that we can do at a practice level to work better together, to bring different thinking together. But really, we need some leadership and investment in reshaping these structures and these systems, because they've become very siloed. I was just at a conference earlier today. I'm actually still at the conference in the hotel room, and we were discussing what are the barriers to this transformational change. The session this morning was with the National Children's Commissioner, Anne Hollins and Jess Hill, and we were really talking about what would it take for us to say in 30 years we've made that change. Children are safer at home and we're not removing them at the rates we are today. And, a few of those ideas that were shared in the room are worth sharing here, because they're the things we're always talking about. There's too many silos. The workforce isn't enabled to work for the best interest of the child a lot of the times, but within certain constraints of what they've been funded to deliver, and then hoping that the next person will take it on from there. Norms across how we view children, how we view domestic and family violence, how we view what abuse is or what neglect is. It's different across all the 5 different types of abuse that Daryl mentioned about that the ACMS looked at. So we really need to kind of come together and get that sort of endorsement from government that they are going to invest in this and enable those systems to change, not just expect community to be able to pick it up and run with it. And I just wanted to share a few quick ideas from the webinars that NAPCAN ran in Child Protection Week. We had some really great experts talking about similar themes, and again, the things that came across from the whole week of conversations were about stories, about how important it is to use stories to bring people along, relationships, how important and central they are to children's lives and families' lives, and even relationships in a professional sense with caseworkers and support services and your GP and your teachers. All of those relationships really matter, and people realising how deeply they matter to the outcomes that children are able to achieve in their lives. And obviously lived experience and co-design is a big part of that as well, to be able to really value the experiences of the people that we are trying to work with. And I think one of the things that has been critical, and I've heard a few times now, is not to think of co-design as this kind of end bit, or even something that you do once you've got a concept, you design it with the community and then you go back and you test it again, but really to integrate that thinking throughout the process. So how do you have people with lived experience involved at all different levels of shaping a project? And we heard from Dr. Paul Gray from University of Technology in Sydney in one of our webinars, who said exactly that. We must engage communities at the beginning of the process, not somewhere down the track. This will shape how we define the problems and then understand solutions. Because if we're not defining the problems in a way that makes sense to community, then we're making assumptions that might really be unhelpful. And we heard from a fantastic practitioner and a director of a service, Biljana Milosevic, who's talked about how do we elevate culturally and linguistically diverse community voices? How do we bring faith leaders and thinkers into these conversations and make sure that these voices are an important part of the cultural change puzzle and not just kind of coming in again at the end as part of either an implementation strategy, like let's equip these faith leaders to have these conversations, or as just a consultation, but really working very much closely with them. And we heard from Chanel Contos from the young people's perspective and saying, from her perspective, the change that needs to happen happens at the intersection of young people's voices and the experts working together. This overlap is where the ideas, methods, and ways of making change happen. And I'll just share two more quick things before I get Daryl to have a bit of a comment as well. And I'd love to hear if there's any questions from the audience that are watching today. But there's actual systems change that we need. We've talked about this, and Paul Gray again said, reproduction of old structures constrains the possibility for real change. So we're not going to have, he had this metaphor of a house. He said, this is not a renovation within the existing foundations. We need to shift the restrictions, rebuild the systems and the foundations with the kids at the centre. If we're just working within the constraints of what we have, we're never going to get where we want to be. And we hear this all the time across different systems: housing, childcare, education, transport. We need to think more broadly beyond schools as well. We're often just kind of defaulting to schools being the place where we think we can tack on more things to support children and families, but really schools are getting overwhelmed. So again, unless we have that sort of authorising environment where schools are enabled and empowered to do more and funded and structured in a different way, it's not going to really work to just keep asking them to do more beyond their scope. How do we have that reimagination of those services? Another thing that's come up a lot in our work at NAPCAN has been urban design and play and opportunities for families to come together in informal ways and support each other and build those networks that we know are really important, that social capital that keeps people going, because it's not just about services, it's about informal supports at the community level, but that are supported and invested in and kept going. So I do want to just share one example here for just to kind of help us think about how these issues are always interrelated, but we're saying break the silos. What does that mean? Well, one example is really to, I think of them as Russian dolls. You look at an issue, but then there's something else underneath it, and there's something else underneath it. So childcare subsidies. We heard a lot in the media about, the government's increasing childcare subsidies. It's going to make childcare more affordable, federal government announcement. Then we got lots of articles in the media saying, well, the fee increases have been eaten up by centres increasing the rates for parents, so the fees that are actually being charged to the end families, and therefore actually people aren't better off, or in some cases maybe are worse off. But the issues there for those childcare providers was really also about the workforce shortages. We don't have enough childcare workers in the system at the moment. We also know that casual rates pay better for the workers in these jobs. So there's been a casualisation of that whole workforce. Centre costs have also increased and all those sorts of things. But my point here is also that the conversation and the rhetoric in the media has been about getting women back into the workforce. The childcare workforce is actually predominantly women. It's predominantly female workforce. A lot of them are from culturally and linguistically diverse backgrounds, and it's a low-paid occupation still, and they deserve those wage increases that went with the fee increases. So the subsidies, there's much more to discuss here, and there's many more interrelated issues around migration laws and how we enable, one group of women to be able to get more employment. Are we talking about all women getting, what are these other intersecting issues? So we can't just isolate things. If we're talking about better outcomes for kids, we're not getting quality childcare delivery if we're not looking at this as a holistic issue, because you're actually not getting quality and consistency if the workforce is casualised, if they're moving on, if they're not actually you know, staying as childcare workers. You're losing that expertise and that thinking. The other thing about workforce is, you know, if we're really looking at prevention, we need to look at the emerging workforce. We need to work with universities and training institutions and really talk holistically, so it doesn't become a tack on later that you're trained as a childcare worker or a social worker, here you're trained as a teacher, here you're trained as a health worker, but actually you should be thinking in a child and family centred way, so that when you come into the workforce, you're already thinking like that. It's not something you need to be retrained in, so you're unlearning all the things that you've learned about just focusing on your bit. We need to redesign these systems and have these conversations differently. And I'm sure Daryl has lots to say about these things, but one last point, and I'm going to throw to Daryl on this, is accountability as well. You know, where does accountability sit? And I've heard Daryl talk a little bit about perhaps the Centre for Disease Control, similar to the one in the US, where, you know, the prevention of child maltreatment is central to someone's mandate, and they're ensuring that the systems are aligning and working together, not just assuming that governments in their existing roles and structures will be able, because at the end of the day, there are political cycles and budgets and things that government will always be pulled into. Yeah, so I think I'll bring Daryl into this here by saying also that the slide that Daryl had thrown up, there we are. You know, so this is why NAPCAN, along with eminent partners and thinkers like Daryl yourself, we made this call in Child Protection Week at the launch, because it's about untangling the many threads and looking at how we collectively reimagine the way services are delivered. Treasury, you need the data thinkers, you need all different sectors to come together and have these conversations. And it's not just about experts, about lived experience, about different voices, so that we can really look at the accountability structures and governance of what we're trying to achieve, because there's some really good things out there, but we're not finding that we're having the outcomes and the impact that we collectively want to have. The summit is a starting point, not the end point. It's a way of bringing people together to have these conversations and see where we can land together in this new world. So I'll invite Daryl and yourself, Kieran, back into the conversation if you've got thoughts and reflections.
Thanks, Rani. Yes, certainly that the need to look at the systems change and the holistic aspects of wellbeing for children certainly resonates with Erase's approach to what we do as well. Daryl, Rani's just talked about the possibility of a national summit. I suppose a question that I have for you is, maybe in keeping with that, is, you know, what would you like to see happen now? What's the next step? We've had this research and other inquiries, and including a Royal Commission and state-based reviews. What do you think is the next step in this area?
Yeah, look, the reason why I was one of that group that Rani mentioned who is calling for this is because we see that we can't just keep going down the path we've been going down of continually trying to respond to the problem of child maltreatment. And we've got a national framework for protecting children that's largely about that response side of the equation. And absolutely, we need to do a better job of caring for children, particularly when they're removed from the care of their parents. But let's make their job easier. Let's actually do a better job of prevention so that there are less children exposed to such high risk harm that they have to come to the attention of a statutory child protection system. And so the call that we've been making really is to try and get some political attention on the problem of prevention, or the opportunity of prevention, you know, the problem of child maltreatment, but the opportunity is prevention. So for a start, I think the language that we use is this very othering thing. We see it as a rare problem that's happening somewhere out there, rather than, you know, in, you know, our homes, our families, our, you know, schools, etc. But secondly, we don't frame it as a preventable problem. You know, and I loved the language, Rani, that you used around, you know, children do better when parents are supported. That's the language of prevention. So, and we also treat it as though it's this sort of black box where, you know, you say we need to do better at addressing the problem of child abuse and neglect, and then we have this black box about, and some magic happens and suddenly children are safe. But in fact, that black box of children do better when parents are supported, there's a whole lot of evidence that goes into what actually works there, and it looks different in different places, but it also takes money and investment. It takes, you've mentioned, Rani, the idea of workforce. Workforces have to actually be trained in either delivery of those evidence-based interventions or practice frameworks that align. So if you're working, for example, in an early childhood centre or a school, it doesn't mean that every childcare worker or every teacher has to know how to deliver a parenting program. But it might be that you have someone from the child and family welfare sector, maybe somebody who's on the webinar listening right now, who does have that skills and can be working, in a school or in a childcare centre or in a health setting, running a supported play group, whatever it might be. How do we get those skill sets in? And then if I'm a teacher or an early childhood educator, how do I work with that expert who might be coming in and supporting me? Or even better still, that they're not coming in, they're actually located already in my service, which goes to the issue that you mentioned before, Rani, about the kind of, physical infrastructure. It's not only of the community, it's also of those assets that we have called schools, early childhood centres, which, in my personal view, it's unfortunate they're largely privatised rather than having a sense of it's a public good, it's an asset, and how do we make the most of that? So it does mean kind of tipping things up on its end, and that's why, we collectively are calling for a national summit, because we have to have all of those thinkers together. And they, surprisingly, have never been in the same room together with the conversation with the P word, prevention. They've never been called together to say, what would prevention look like? And what's your role? What can you contribute to this? Do you have an evidence-based intervention? Do you have a platform that could be deployed? Do you have a particular skill set? Do you have, trusted relationships with parents and carers that are non-stigmatizing, that can be leveraged for provision of what you said before, Rani, in terms of that, supports for parents in order to help children feel safe?
Thanks, Daryl. As you can see, there's a change in the screen there. If anyone has any questions, now's the time to quickly pop them into the questions section of your go-to panel. We do have a question from earlier. Daryl, someone said they were wondering if the 4 main risk factors for multi-type abuse are compounding. So if you're experiencing more than one of these, which we, as you've discussed, is likely, is it a compounding thing or?
Yeah, look, that's a great question. We haven't actually done that analysis. What we did was control for other factors, because we're wanting to look at the unique contribution of each of these risk factors. But we know that many of them overlapped, and therefore, if we put them all together and looked at the odds ratios of having 2 or 3 or 4 family adversities, other research suggests that absolutely that would be the case. But hand on heart, I haven't done that analysis with our data yet, but I can be very, very, very confident that the answer would be yes, they would compound.
Is there any plans for any further extensions in the research coming out of the larger research piece?
Yeah. So if I haven't got grey hair now, I certainly will do by the end of this project. We've got probably about 20 different papers or more under various stages of, planning, analysis, write-up, submission. And we see that, primarily focusing on peer review journal articles is a way of making sure that, our colleagues in the research field are kind of vetting and calling out any errors that we might be inadvertently allowing through. So do watch out on the ACMS website, where as new publications come out, they will be made available and links put on that website. And wherever possible, all of the articles will be open access, which means that you don't have to be in a university with access to those paid subscriptions in order to be able to read the article.
Another question that we have is there seems to be an early focus on teaching independence, self-soothing and not responding to children's needs for fear of spoiling them, as evidenced by current investment into sleep schools and early parenting centres, many of which teach ignoring babies' cries and scheduling responses and feeding. Just scrolling down. How do we shift the paradigm to responsive and sensitive care? And is this something that you think is playing a role in what you're seeing?
Yeah, look, I think that there are a range of different parenting programs and strategies that have an evidence base around them. I don't think any of them that are evidence-based are ones that would actively encourage ignoring, certainly not for long periods of time. It might be part of a controlled way of helping learn emotional regulation. So I certainly don't want to speak against that. But absolutely, there's some fantastic programs out there that focus exactly on those issues of supporting emotion regulation. And another one that my colleague Sophie Havighurst has talked about with me often is the importance of parents learning to self-regulate themselves. So it's not just about how do we teach children to do this. Often when we've got a child that's difficult to settle, or is being emotionally reactive, they come home from school and they're throwing a tantrum, we often are reacting then as parents to that, what we call bad behavior. And so being able to, first of all, be in control of our own emotions and recognize when we're getting triggered by what's going on in our environment, and then learning how to teach that skill to our children is really, really important. And that's the focus of a lot of really great quality evidence-based parenting programs and supports.
Yeah,
Rani,
I would. That, yeah, I was nodding vigorously because I agree so much with all the things that you're saying there. We need to look at evidence-based parenting programs. There's so much information out there for parents, a lot of it that's not very well vetted. So, the Raising Children Network and Triple P and other parenting programs that we know have a great evidence base behind them and a vetted information are really important places to go when you're looking for support for parents. And the regulation piece is so important. We know that neuroscience is critical to this conversation, how brains develop in early childhood, but also the unmet needs of parents and adult caregivers then having impact on the children. So that intergenerational cycle, and how can we support adults getting the supports they need, and adult services being more responsive to parents' needs and more aware of their responsibilities as well. How do we set parents up for success in their role as well? And I know, Daryl, we've spoken about this before in terms of when someone's having a baby at those early years, that early stage, how do you prime them with the right information and make this more of a universal access piece so that we're lifting the baseline of knowledge around parenting as well. And that's something I've heard your colleagues as well, Daryl, talk about around emotional abuse. We need a stronger public health campaign to prevent emotional abuse. We need to be having the whole conversation around what it is, what does it mean to have words that help rather than hurt? What does it mean if children speak up and say that they actually are being hurt? How do we empower children with the language to be able to speak up? But how do we help adults understand that that matters as well? We've kind of made some progress in the physical discipline area, which we can see through the ACMS in the younger cohort. But what are we doing with emotional abuse? We need to have these conversations and give parents some tools that are practical and easy. And I just wanted to say also just really quickly about the framing as well. We need to talk about these issues differently. And I just wanted to say that we had a really great conversation with the Frameworks Institute around this as well in Child Protection Week, which is about when you hear the ACMS results, etc., you can't help but be overwhelmed. And so it kind of can trigger fatalism in this sense that, oh, these problems are too hard, they're too big, how do we fix it? There's nothing to do, so you're a bit powerless. What we need to do is make sure every time we're having these conversations, we are talking about the solutions. We're really centering those solutions and the fact that there is hope, that there is change that we're seeing in certain aspects. We want greater change, but, to make sure that people are left with that sense of hope and the sense that we can be agents of change. The other thing that we really need to work against is individualism and really talking in that family bubble as if it's, individual parents making these adverse choices and disciplining their kids. No, this is actually a collective issue, and the pressures we're putting on parents, those stresses, are the things that are environmentally in our control. It's a social harm, it's a public issue, but it is preventable. And we try not to other, you know, the families that are experiencing this, and often that's the way media reports things. So it's a bigger conversation of how do we bring all these other sectors along and talk about these issues differently so that we can actually cue prevention and not protection, because protection is a very response-centred approach, and we're really talking about those things that come way before then. Yeah, thanks. Just wanted to throw those in.
Yeah.
Thank you. We are right on time, so I'm sorry for those of you whose questions we didn't get to, but I want to say thank you to both of you for joining us today and sharing your expertise, and to thank our audience also for joining us. Please do, eventually the recording will be available in the coming days on ARACE's website and on our YouTube channel. And there'll be links shared in the weekly ARACE e-bulletin. So if you're not already a subscriber, you can do that. We'll have news events and future webinars, and the link to that is in the chat box at the moment. So we'll bring this event to a close now, and thank you both again, and we look forward to seeing you all at our next webinar. Please do keep in touch with Daryl and Rani through their respective organisations. If you've got any specific questions, perhaps they'll be able to respond that way. So thanks very much, everyone.
Thank you. Thanks, Kieran.
Bye.